Catherine, what would you like, if you could talk to people about gastrointestinal cancers and I suppose a message that you want the people watching this to get from this, what would you like to tell them?
I would probably just like to raise awareness of gastrointestinal cancers and how much we need to look at researching, because there are some rare cancers which don't have a lot of research and there's not a lot of treatment available for our patients. So whereas prostate and breast cancer, they get a lot of funding and support, and we'd like to just raise awareness to be able to increase our funding for these rarer type cancers.
So it's just people hearing about gastrointestinal cancer. How does that make it easier?
Well, being aware of what gastrointestinal cancer is, because not all people are aware, and having some awareness that there isn't a lot of treatment available for people with this sort of cancer.
What is it? What is gastrointestinal cancer?
Well, we would describe it from here to here, anything to do with the digestive system. So that would be your esophagus, your stomach, your pancreas, your liver, gallbladder. Is that about it?
And your bowel.
And your bowel. I forgot about your bowel.
Yeah. So there are some very rare cancers among those more common cancers. So one example is a trial we were just talking about actually for metastatic anal cancer. That's a very rare cancer in Australia, thankfully, but we have a clinical trial called the Attica trial for people with metastatic anal cancer using a new sort of chemotherapy drug instead of standard chemotherapy. So that's really useful. For those rare cancers. It's very difficult to get funding in clinical trials for rare cancers.
Is it hard to convince patients to get on clinical trials?
Not always. I think what we've got to do is educate both our doctors and the patients that clinical trials are available. And we encourage all of you, if you are a patient undergoing cancer therapy, to ask your oncologist about clinical trials in your institution, because we try and have clinical trials open in most cancer centres in Australia.
Catherine, you see patients at the end of their lives. What's your view on getting them involved in clinical trials?
I think it's very important that they're aware of what options are available to them. For some patients, from where I am, it means that they need to travel, but a large proportion of patients are prepared to do that, even at the end stage of their life, to make a difference for them potentially and for other people with gastrointestinal cancers.
What happens on a clinical trial? What does it mean for a patient? Does it mean more painful biopsies and things like that?
Sometimes more biopsies are required. Sometimes that may be true, but often that's an optional consent. But most of the time our clinical trials involve the opportunity to receive a new treatment. Often this is in a randomised fashion, and this is a really important concept for people to grasp, that the trials are often run in a way that there's a 50% chance of getting the new treatment and a 50% chance of getting standard therapy, because we don't know for certain that the new one is better. So that's one important element. But generally speaking, someone on a clinical trial may have more visits to their hospital, for example, and perhaps more blood tests. But they're very well looked after in that process.
They get quite a lot of close monitoring throughout the clinical trial.
Have you taken part in any clinical or helped the patients through clinical trials?
I've supported them, and particularly in trying to get them to clinical trials off-site rather than in our hospital. Most hospitals, when patients are involved in a clinical trial, they have separate clinical trials nurses that support them while they're on that trial. Okay. So it's just more facilitating patients getting onto those trials and making them aware what's available to them.